Okay, let's dive in. We're looking at a really fascinating article today. It's called Surgical Time and Risk in Cosmetic Surgery by Israel A. Posner.
Yeah, it really tackles something that, maybe doesn't get talked about enough with patients.
Exactly. How long you're actually under anesthesia for a cosmetic procedure and how that impacts your safety.
Hmm.
So our mission today is really to unpack this source, explore what the author calls the anesthetic clock.
Right, and see how that clock ticking affects risk for different people, even like really healthy patients.
It's interesting because cosmetic surgery, obviously people focus on the results, the aesthetics,
Naturally, yeah, that's the goal.
but every surgery has risks, even elective ones. And this article really pulls back the curtain on, well, time, the sheer time spent on.
It's a critical factor and maybe underestimated sometimes. The article shows it's not just a flat risk level. It climbs the longer things go on.
So this ticking clock idea, the source connects the duration directly to complications after surgery. It's not just about, say, how complex the surgery is.
That's a key point. Complexity matters, of course, but time itself is an independent variable.
Okay.
And it makes this really important point early on. This affects everyone, even ASA1 patients.
Remind us what ASA1 means.
Oh, right. ASA1 basically means you're healthy, no significant medical history, probably a non-smoker, the lowest risk category, generally speaking.
So even for them, long procedures create challenges just because of the time.
Exactly. Their bodies still have to cope with the effects of prolonged surgery and anesthesia just by virtue of how long it lasts.
Okay, that's surprising. If someone's healthy, why does the time itself make such a difference? What's actually happening physically during those extra hours?
Well, the paper digs into a few key things.
Sure.
One is pretty straightforward: prolonged tissue exposure.
Meaning the longer the surgical site is open.
Right. The longer it's open, the more chance there is for bacteria to get in. So the risk of surgical site infections, SSIs, just goes up.
Makes sense. More time, more opportunity for germs.
Precisely.
Mm-hmm.
Then there's the anesthesia itself, an increased anesthetic load.
More drugs for longer.
Yeah. More time breathing anesthetic gases or getting IV agents. And that increases the chances of side effects. Simple things like nausea, maybe, but potentially more complex effects too, even in healthy people.
And the actual surgery, the physical manipulation.
That adds up over time too. Longer operations usually mean more handling of tissues, more dissection.
Right.
This leads to a greater inflammatory response, more tissue trauma overall. So you might see more swelling or a higher chance of hematomas or seromas forming.
Hematomas are blood collections, seromas are fluid.
Correct. And they're not just uncomfortable. They can slow down healing, and sometimes you need another procedure to deal with them.
I guess just lying completely still for hours must also have an effect.
Oh, absolutely. And the article really stresses this as a major safety point: immobilization and the risk of venous thromboembolism, or VTE.
Okay, VTE, that sounds serious.
It is. It includes DVT, deep vein thrombosis, clots usually in the legs, and the big one, PE, or pulmonary embolism, where a clot travels to the lungs. That can be life-threatening.
And this risk is tied to just being still.
Directly tied to being immobile on the table and in the early recovery period. The source makes it clear that this risk just subtly climbs with every hour you're immobilized. It's not like a switch flips, it just creeps up.
Wow. So it's not just the cutting and sewing, it's the stillness itself.
It's a huge part of the equation.
Yeah.
And when you add all these things together, the exposure, the anesthetic drugs, the tissue trauma, the immobility, the cumulative stress can actually mess with your body's healing.
Leading to delayed wound healing.
Yeah. Or maybe issues with scars, or in some cases, wounds actually opening up, which is called dehiscence.
And the article backs this up with studies. It's not just theoretical.
No, it refers to research. For instance, in procedures like tummy tucks or breast augmentation, studies have apparently shown that once you go past certain time thresholds, the complication rates go up significantly.
Like, measurably.
Some analyses suggest you can actually see a percentage increase in the odds of complications for every extra, say, 30 minutes or an hour the surgery takes.
Okay, so the risk definitely climbs. It doesn't stay flat. The source tried to illustrate this climb, right, with a kind of model. I found that part really helpful.
Yeah, it's a good way to sort of visualize the concept.
Right.
But it's crucial to remember these are illustrative numbers. They're based on general assumptions from research, not a crystal ball for your specific surgery.
Understood. It's about seeing the pattern. So the model starts with a hypothetical healthy person, that ASA1 patient.
Right, and gives them a hypothetical baseline risk for any complication in a very short procedure. Let's say 2%?
2%. Pretty low.
Seems low, yeah. But then the model applies this idea of compounding risk. like interest building up.
Ah, okay.
Based on that finding of maybe a 10–14% increase in odds per half hour, the article suggests an illustrative factor, like multiplying the odds by maybe 1.25 every hour. It's not just adding risk, it's multiplying it.
Okay, let's trace that for the ASA1 patient. Starting at 2%, what happens after an hour?
Well, using that illustrative 1.25 factor, after 1 hour, the risk might climb to around 2.5%.
Still low.
Yep. After 2 hours, maybe it's nudged up to about 3.1%.
Okay.
But here's where it gets interesting. By the 4-hour mark, that illustrative risk is getting close to 5%.
Ah, starting to see a bigger jump now.
And if you imagine a really long procedure, say 8 hours, that illustrative risk could be over 11%.
Wow. Okay, from 2% potentially up to over 11%, just based on time, for someone who walked in perfectly healthy. That really shows how time is this sort of stealth risk factor.
It really does. It just highlights that duration itself is a physiological stress. Of course, the specific surgery matters, the surgeon's technique matters, your own body's resilience matters.
Yeah.
But that underlying principle of risk climbing with time is, well, it's fundamental.
Now, things look quite different, according to the source, when we consider patients who aren't ASA1, people with pre-existing health conditions.
Right. This is where that ASA classification really tells a story. So ASA2 patients, they have mild systemic disease, usually something well-controlled, maybe well-managed high blood pressure, or type 2 diabetes that's controlled with diet or pills, or factors like smoking or obesity. Their bodies are already dealing with something else,
Got it. And ASA3.
That's more serious. Severe systemic disease that limits their activity but isn't immediately life-threatening. Think poorly controlled diabetes, maybe stable angina that's chest pain from heart issues, or morbid obesity.
And cosmetic surgery would be less common for ASA3.
Much less common, yeah. And approached very, very cautiously because their baseline risk is already significantly higher.
So if we take that same idea of time multiplying the risk, but we start from a higher baseline for ASA2 and 3, the effect gets magnified.
Hugely magnified. Risk curve just shoots up much faster. The source uses illustrative baseline risks, maybe 4.5% for ASA2 and a pretty high 9% for ASA3, just to show the difference.
Because their bodies have less reserve to start with.
Exactly. So when you apply that same compounding time factor, the absolute risk gets much higher, much quicker.
Let's look at those illustrative numbers the article gives for them. What does it look like for ASA2 over time?
Okay, so for an ASA2 patient, starting at that hypothetical 4.5% baseline, by hour 4, their risk might be nearing 10.5%.
Okay, already quite high.
And by hour 8, it could be over 22%.
Wow, that's a steep climb. And for ASA3, starting way up at 9%.
The illustrative model suggests they could be approaching almost 20% risk by hour 4. And if the procedure went to 8 hours, you're looking at a potential illustrative risk of around 38%.
That's incredibly high, a nearly 40% chance of some complication.
It's daunting. And it really just hammers home how someone's underlying health status dramatically changes how their body tolerates the stress of a long surgery.
Yeah, it means certain complications must be way more likely in those groups too.
Definitely. Things like VTE, those blood clots become a much bigger worry. If they have heart conditions, cardiac events are more likely. If they have diabetes, wound healing can be much poorer. Respiratory issues can be exacerbated by obesity or lung conditions. The list goes on.
Okay, so given these escalating risks, what are the specific complications the article calls out as being more common or worse with longer surgeries, particularly in those higher ASA groups?
Well, it lists the main suspects. We mentioned surgical site infections, SSIs, more likely with longer exposure.
Yeah.
Hematomaseroma, more likely with bigger dissections and longer or combined procedures than that big one. Venous thromboembolism, DVTPE. The risk climbs with immobility time, and is especially high if you already have risk factors like obesity or smoking, which are common in ASA2 or 3 patients.
Okay.
Also, adverse scarring and wound healing issues. These are much more common when healing is already compromised by disease like diabetes or if another complication like an infection happens.
What about the anesthesia itself again?
Yeah, anesthesia complications. Prolonged anesthesia really taxes the heart and lungs, and that's tougher for ASA2 and 3 patients. Also, in very long surgeries with big fluid shifts, you have a higher risk of fluid imbalance or electrolyte disturbances.
And then there are risks tied to the surgery itself, like nerve damage or things not looking symmetrical.
Exactly. Specific procedural complications. Sometimes, if a surgery turns out to be unexpectedly difficult or just takes longer, the risk of those specific issues might also increase simply due to the extended time and manipulation.
Okay, so we get the problem. Time equals risk, risk compounds, and it's worse if you have health issues. But the source doesn't just leave us there, right? It talks about how to manage this. Strategies.
Yeah, definitely. Knowledge is power here for both the surgeon and, importantly, for you, the patient. A really key strategy is open communication.
Talking about the time factor up front.
Absolutely. A thorough chat about how long the surgery is expected to take, why it might take that long, and what your personal risk looks like based on your health, your ASA status, and that expected time. You really need to understand this anesthetic clock concept.
Does how the surgeon actually plans the surgery matter?
Critically important. Strategic surgical planning is highlighted. For instance, if you're thinking about getting multiple things done.
Like a mommy makeover or something.
Right. It might actually be safer to stage those procedures, do them in separate, shorter operations over time, rather than one super long marathon session, especially if you're in a higher ASA class or the plan is very extensive.
Makes sense. Fewer hours under at any one time.
Exactly. And also, just using efficient surgical techniques, being meticulous but not taking longer than necessary, that can help too, without compromising the result.
And during and after the surgery, what can be done then?
That falls under meticulous perioperative care. Things like using VTE prophylaxis, maybe compression stockings or devices on your legs, or even blood thinners in some cases to prevent clots.
Okay.
Strict antibiotic protocols to minimize infection risk. Keeping your body temperature stable because getting cold can affect healing. And of course, the anesthesia team tailoring the anesthetic drugs and techniques specifically for you and the expected length of the surgery.
So wrapping up this deep dive then, the main message from Posner's article seems really clear. Surgical time isn't just about scheduling.
No, it's a fundamental factor driving risk. And it's an escalating risk.
It's a challenge even for healthy ASA1 patients, where it can turn a low risk into something more significant over several hours.
And for patients who are ASA 2 or 3 with existing health issues, that same time pressure has a much bigger impact, leading to considerably higher risks because their bodies just have less reserve to cope.
So understanding this connection time equals escalating risk, it's vital for the surgical team planning things.
And for you, if you're the one considering cosmetic surgery, it helps you make a truly informed choice, weighing the aesthetic goals against the safety implications of the procedure's length.
It allows for that crucial conversation about balancing what you want aesthetically with what's safest for your overall well-being.
Which have to be the priority.
And maybe the final thought to really sit with the one the source kind of leaves us pondering is this. Success in cosmetic surgery isn't just measured by the before and after photos.
Right. The most successful surgery is when you look great and feel great after, emerging healthy and whole.
And knowing about this anesthetic clock, understanding these time-dependent risks we've talked about, that's a really key piece of information for you to have to help make that safe outcome a reality.